I was noticing that Bryce was starting to get a lot of bruises in some unusual places, and I took him to the doctor, and he had got a blood test, and it was actually Good Friday, so April 6th of 2010. And later that day, we got a phone call saying that there was a room for him at Children's Hospital, and he needed to get there now. And so our concern was, what does that mean? What's going on? And at that point, we didn't know what his diagnosis was. All we knew was that his blood cells were not at the level where they needed to be. So we checked in later that afternoon, not knowing what we were up against. And after many more blood tests and a bone marrow biopsy, we found out that he was diagnosed with severe aplastic anemia, which is a condition in which the bone marrow stops making enough healthy blood cells, so the white cells, the red cells, and the platelets. So after another week or so of contemplating what would happen next, his best prognosis was to have a bone marrow transplant. So they tested, at that point, I had a 2.5-year-old daughter and a 1-month-old daughter, and they tested both the girls and myself and my husband to see if any of us were matches for Bryce. And in my opinion, it was one of kind of the funniest things once, in this moment of, major stress and everything else going on, when the nurse actually came in to tell us that the girls were a match. Bryce looked at me and he said, "Well, of course we match." Like, so matter of fact and, simple. So for us, that was a huge gift that both of our girls were a match for him. They couldn't use any of Kira's marrow because she was simply too small, being 1 month old. So his 2-year-old sister graciously gave of her marrow to him. So he was inpatient at Children's Hospital for about 10 weeks with his transplant. Experienced the ICU there, had a major anaphylactic reaction to some of the medications they used to treat him. So we kept the doctors on their toes in terms of having to find other methods, and he became great friends with a lot of the staff at the hospital, his nurses, his doctors. We're so incredibly fortunate to have Dr. Margolis literally in our backyard. He became great friends with the Flight for Life staff, stopped in, and he's gotten an awesome bond with them, and they've invited him out to Kreitzfield to see their helicopter, been at different events that we've had for him. They've shown up there, and he's been fortunate to get to actually attend the MACC Fund Bucks game, which to him, we couldn't go to a Bucks game normally because of his immune system being so compromised, but when they called from the clinic at Children's to say, "Hey, we have tickets for the MACC Fund game. It's in a box suite, so you're not going to be exposed to everybody. Can you guys go?" My immediate question was, "Can we go? Is that something we can really do?" And they're like, yes, you can go. Yes, you need to go. And we went, and the kids had an absolute blast.
Recipient.
Yep, Bryce was 4 and 3 months. So I will remember that forever, because I remember looking at the documents always, 4 years and 3 months, like, what is going on? The glass is half full and not half empty, and there's so many other things that people deal with. And, like we said, we were lucky that we had our donor. We didn't have to hunt for a donor, and the two of them are absolutely inseparable. They do go everywhere together. Belle would come right with Bryce to clinic all the time, and, for Bryce, it was a challenge and a chore sometimes to go to clinic to get different procedures done, and Belle was right there with him. And the funny thing too is when we talked to her a couple days before the second transplant and said to her, "Bryce needs some more of your good blood. Will you give Bryce some more of your good blood?" She looked at me and she said, "I already gave him my blood." Like, what do you mean he needs more? And I said, "Yeah, I know, you already gave him some, but he needs a little bit more." So luckily she was willing to help him out. And yeah, that's what we said. They will for sure forever have a bond that's been formed. The nurses and the doctors and just the whole community of people that you work with, they all welcome in. We walk into clinic and Bryce is, literally welcomed almost with open arms. He says to me now that we're on to, we were going to the MACC Fund clinic every 2 days through, for 3 months. We were there every other day. So it was such his normal routine. And now we're on to actually only going once a month. And it's amazing to me because Bryce will say after about 2 or 3 weeks, he'll be like, "When do we go to clinic? I miss my nurses." It's an amazing experience to have to go through something, a life-threatening illness with your child, and to have the support of the MACC Fund and Children's Hospital. We're very blessed.